about the cancer, he only did elliptical and he didn't really exercise as much because he's afraid to hurt that bone. Yeah, but alhamdulillah, ever since wearing the pants, wearing the scarf, the boxer, because that's where the cancer is, he has been more active. He is less.
Hi Amy, okay, I heard that you have a very good testimony about your husband who have consumed Shiruto. Maybe you can share with us a bit about your husband's condition and maybe about his improvement after taking Shiruto.
Okay, hello everybody. My husband was diagnosed with solitary fibrous tumor on September last year, 2022. Yeah, so during the diagnosis, he actually had a growing lump at the back of his head, which slowly grew bigger throughout the years lah. So we decided to take it out because it was causing a lot of pain to him. So we went to a neurosurgeon. The neurosurgeon, as usual, did MRI, and then they suspected that it could be cancerous. So after we did the biopsy, doctor confirmed that it was a solitary fibrous tumor, which is a very rare tumor that is not really known in the world lah. It's a 1 in a million kind of tumor. So doctor was saying that the treatment is not going to be easy, mainly because there's not enough studies. Yeah, so we had to choose between going for operation, straight away going for operation, ataupun change or try to reduce the tumor size first. Because if you go for the operation, they will have to shave off 2 cm of his the bone, back of his neck. Yeah, so they said, okay, 2 cm, then I may have to put a metal plate. Yeah, so it's the quality of life will definitely be affected. So we decided, okay, look for options. So our oncologist said, okay, there's another option, but it's only 30% chance that is possible. So she said you can eat this medication, it's called perzopanib. So it's a common medication used to shrink the tumor or control the tumor from growing, prevent it from growing. So the doctor said you can try this. You don't have to worry about spread because it's been there in your head for 3 years. So it's a very well-behaved tumor. So just give it a try if you want to delay or to see whether can shrink it further. So we decided to go for that route because we wanted to try our best in 3 months, see how can it shrink even further, or if not, then just go for the surgery and just pray for a miracle. So during the whole time, I was wondering, there must be something that I can support you with, because the side effect of perzopanib is diarrhea, and then the pigmentation of the skin will be very light and everything. That one is fine, it's just vanity, but then the pooping, the diarrhea. So when he first started, he pooped like 6 to 7 times a day, and then he got really weak. So I asked my outline Atika. So she told me, okay, why don't you give him Shiruto? It can help. It can help to boost his immune system, to make him less weaker, and then just give because it also has anti-cancer properties. You never know, it may help to shrink the tumor. So I asked the doctor, and the doctor said, oh, Shiruto looks fine, so you can go ahead and take it. Okay, so he took 4 sessions a day without fail during the treatment. From the start, we did 4 already. Yeah, so 4. Then after that, 4. Then there are days when he feel weaker. I told him add 2 more, 6. Yeah, so we really didn't scrooge basically. Yeah, we didn't scrooge on the supplement because we really wanted him to get better. So he just, I think about a week into eating it, terus dia punya diarrhea is lesser. But it's more controlled, and he didn't get weak. He can still exercise. Yeah, while he's on Shiruto lah. So sadly, we went for the surgery. When they did the CT scan, before surgery have to do CT scan again. So when we did the CT scan, found out that the tumor somehow didn't stick to his bone. The doctor said, okay, you know what, after seeing this, right, I think instead of 2 cm, 2 mm. We just shave off. I think you'll still be able to hold on to your head. I think you will not have to worry about your head dropping. Okay, I think your quality of life will be the same lah. So we thought, okay, Alhamdulillah, right? Alhamdulillah, like really, because we istikharah, we did everything we could, to ask for a direction for the best solution for him. Because if he had chosen to go for the surgery there and then kan, habis lah. Basically he would have a metal plate there and he'll be Robocop. Yeah. So basically after that we decided to go with the surgery. They really shaved off a little bit only. Alhamdulillah, found out that they managed to take out the whole thing. Margins are clear. But sadly, during the recovery process, I made him wear the scarf. And then after that, he only cut down to Shiruto because nak say. So I think that is where we shouldn't. Okay, that if I could change, I would have continued giving him 4. Yeah. So basically, his wound became very clean, very nicely healed. Yeah, it's amazing. Yeah, but after 3 months scan, his first scan found out that it spread into his bone. So we found out that it is very big, 3.5 cm. It's not that big, but for the 3 months, for SFT to grow that big inside his pubic ramus, they call it, yeah, which is the butt bone lah. For it to grow to 3.5 cm is alarmingly fast. So doctor was like saying, okay, you know what, start treatment. Let's just go aggressive. We just go for every 2 weeks. We do chemo. That means you eat the chemo pill and then you do immunotherapy once a week. So he continued to eat Shiruto on treatment week because it's bi-weekly. So on that chemo week, he will always eat 6. I'll make him eat 6. On a regular week, it's 4. Yeah, because there's no toxicity in Shiruto, right? You can eat as much as you can. So I'm just giving him as much support as I can give him. Yeah. So he ate 6 and then, but we add on Spirulina because Spirulina helps to reduce inflammation. Yeah, and then on top of that, right now, he is also wearing pants, boxer, scarf, yeah, everything lah.
So how is he now?
Yeah, and Alhamdulillah, right now, he just started running. Yeah, he started running because he's actually a very active man. But ever since we found out about cancer, he only did elliptical and he didn't really exercise as much because he's afraid to hurt that bone. Yeah, but Alhamdulillah, ever since wearing the pants, wearing the scarf, the boxer, because that's where the cancer is, he has been more active. He is less tired, especially during chemo. He wears the whole set. Yeah, and then he can still drive.
Wow.
Balik. Yeah,
it helps with the side effect.
Yeah, usually after chemo he will feel very tired. After therapy he will feel very tired because on the day of therapy he will eat the chemo pill and also do immunotherapy. So it's like double whammy tau. And then on top of that they give him bone strengtheners, and bone strengtheners also got side effect. And then on top of that they give him obat pill to sleep. They give him so many things, or the IV injection to sleep and everything. So that generally you will feel groggy. But Alhamdulillah, ever since I've made him wear the pants, the boxer, the scarf to chemo, he has been more active. He doesn't need to sleep after chemo. He feels a little bit more stronger lah, which I think is it's a big deal. Yeah, so I'm very grateful for Shiruto, Spirulina, the whole works for Aulora.
Would you recommend for those who are finding for support, especially yang ada cancer?
Yes. If you're going through treatment, please consider wearing the pants. Please consider buying the pants, buying the top, and buying the scarf. Especially when your head feels like it's gonna explode because you feel like you wanna vomit. I think the whole Aulora series will help you because of the far infrared. Because it can help to relax you and so please use it. May it benefit you the way it benefited my husband.
Thank you so much.